Cancer touches people everywhere in the world. It respects no borders. It has no boundaries. Worldwide, cancer is the second leading cause of death. In 2018, 1 out of 6 deaths in the world was caused by cancer, more than HIV/AIDS, tuberculosis, and malaria combined.
The world is becoming ever more aware of this, and particularly in the developing countries, because that's where 60% of the cancer incidence is occurring and about 70% of the cancer mortality.
Our intention isn't to single-handedly solve the global cancer crisis. We depend heavily on our partners, governments, other international and national civil society organizations, and the private sector.
We're focusing our efforts. We're showing how things that can work in one place with a small amount of resources and where we can achieve measurable results in a fairly short period of time can then be positioned for larger donors to come in to replicate those efforts, to expand them, to make them universal in one country and then eventually in a region and then eventually globally.
At the core of Prevent 20 is a tool that ACS researchers developed to predict how much tax increase is needed for meaningful reductions in smoking. The tool has already garnered significant success in several countries, notably Mexico and Indonesia. Through Global HPV Cancer Free, ACS is working to increase the uptake of HPV vaccination in girls living in lower and middle income countries to address the disproportionate burden of cervical cancer. Worldwide, more than 300,000 cervical cancer deaths occurred in 2018. 90% of these preventable cervical cancers were in lower and middle income countries. In Kenya, we mentored and supported our local cancer organization partner, Women for Cancer Early Detection and Treatment, to lead communications and advocacy in the rollout of the HPV vaccination aimed at 10-year-old girls.
The American Cancer Society, again, pioneered patient navigation in the United States about 30 years ago.
In 3 years of using this program, transformation has happened with Kenyatta National Hospital. The hospital has navigated about 6,000 patients, showing much higher treatment completion rates. It's been imitated by other hospitals in the region, and we're expanding our patient navigation program to other countries now. Through collaboration, NCCN finalized the first 46 NCCN harmonized guidelines for sub-Saharan Africa for more than 86% of all adult cancers in this region. The guidelines have been downloaded over 8,000 times and are endorsed by 6 countries.
IBM is the innovation partner with the American Cancer Society, NCCN, and ACC. Our role is to figure out what kind of technology solutions we could bring together in this partnership so that we can help tackle cancer together.
In November 2019, just 3 years after the initial meeting in Paris, the African Cancer Coalition collaborators announced a new alliance to continue to help improve access to high-quality care and treatment in Africa.
Working together, I could see us implementing the vision of an African continent that is free of cancer.
You know, when I think about our global cancer control program, I'm just really proud of the impact that we're having. I've had a chance to see it for myself in action in sub-Saharan Africa, and I know for a fact that we are saving lives, that we are making a difference, and that feels really great about advancing our mission in the fight against this disease.
Learn more about American Cancer Society Global Impact. Visit global.cancer.org.